Thank you very much, Ruth, and thank you all. Joe asked me if I'd speak at the healthcare session. What he didn't say was we're going to put on two eminent and widely respected clinicians. We're going to put on one of the best journalists in Ireland today, and after that, we'd like you to come up with your fancy economics and talk about healthcare. So, Joe, thank you very much for the challenge. I appreciate that. And I am delighted to be here tonight. The question that Joe has posed, the question we're all addressing this evening, is whether anyone can make our healthcare system fit for purpose. And when I saw that, I was put in mind of a cartoon that Martin Turner did for the Irish Times back in 1984. Now, I was 9, so this won't be perfect recall. But I remember it. It was to do with the Ethiopian famine. And on one part of the cartoon, he had starving men, women, and children. And on the other side of the cartoon, he had well-heeled men and women in suits. And in another part of the cartoon, he had a mountain of food. And the well-heeled men and women, they looked puzzled. They looked confused. And the cartoon said, question, how to move a mountain of food to starving men, women, and children equipped with nothing other than the entire resources of Western civilization. Ireland is one of the most prosperous, developed, safe countries on earth. We should have one of the best healthcare systems, and indeed, as Colin has pointed out, parts of our healthcare system are excellent. Parts of our healthcare system are world class. We spend more on healthcare than almost any country on earth, and when you adjust for age, because we're younger and need less healthcare, we spend more than anybody except the Americans. So second highest spend on earth when you adjust for the fact that we're young. We have some of the best trained doctors and nurses on the face of the planet. We have a very fine civil service. We are enjoying breakthroughs in medicine and in science every day. Incredibly exciting, life-changing breakthroughs. Screening and vaccination programs have been launched successfully in this country and saved lives. Between 2000 and 2009, cancer deaths fell considerably, cardiovascular disease fell considerably, and you've heard from previous speakers about all of the successes that we've had. And so maybe a new Martin Turner cartoon could pose the following question: how to deliver a truly excellent healthcare system using nothing other than vast amounts of money, highly trained clinicians, multiple successes in previous years, and the entire of medical science at our disposal. That's the question. Now, we are not, thank God, Ethiopia in 1984. But people are dying unnecessarily in our healthcare system today, and people are suffering unnecessarily in our healthcare system today, despite its many successes. In the past few weeks, I met two mums whose young children have scoliosis. And if you are in Crumlin, your child will wait between 2 and 3 years to be seen by a consultant, and then several more months to be operated on. Now, that can get so bad that the bone begins to puncture the skin, at which point they will bring the child in for an emergency operation. In Europe, they operate on children with scoliosis when the spine has curved to about 50 degrees. In Ireland, we have so few consultants and resources deployed that the spine of our children will curve to 100 degrees before they are operated on. There's a young man called Andrew in the National Rehabilitation Hospital who I've been working very closely with. He had an accident in a gym in Sligo, and he's paralysed from the neck down. He's quadriplegic. He received superb care in the National Rehabilitation Hospital, and he was discharged last September. And a few weeks ago, I met Andrew and his family and his clinical team, and we were all still trying to find him a step-down facility to go to. Discharged 9 months previously, and holding up a bed that somebody else desperately needed. In Cork today, the waiting time for a child suspected of special needs, the time from the parent suspecting there might be an issue to that child getting intervention is more than 3.5 years. So if you're a mum or a dad and you see your 2.5-year-old son or daughter and you think, you know what, there might be something here, I want to get an assessment. It'll be 2.5 years before your child is assessed. Your child will be 5 before they are assessed. If they are deemed to have special needs and be in need of intervention, it will be more than a year before they get that intervention. Now, in Australia, who lead the world in this, they pour all the resources into early intervention, so much so that they actually stop a lot of the resources at 6 years of age. In Cork, the intervention wouldn't begin until the child is 6 years of age. A constituent of mine had a hip replacement. She was in agony or needed a hip replacement. She was in with Kappa. She was told it would take 1.5 years and it had taken already a year to see the consultant. So I met the team, the clinical team and the management team, and I said, is this the case? And they said, yes, it is. And the reason for the delay was because their annual funding kept being changed by government, and they had run out of money to buy the hips and the knees. So you had consultants with nothing to do, theatre teams with nothing to do, operating theatres fully staffed, fully paid for, not seeing anybody, because the hospital had run out of money for the titanium hips, which cost somewhere between 2,000 and 5,000 euro. I asked if I could fundraise for the constituent, and she'd bring it in herself, and she was told she wasn't allowed. Now, when this government came into office, the standard waiting time, there's different ones across different clinical pathways, but the standard waiting time was 6 months, and they missed that, so they moved it to 9 months. They couldn't hit that, so they moved it to 12 months, and they couldn't hit that, so they moved it to 18 months, and they're not hitting the 18-month target. Now, that is a target so utterly bereft of ambition and love and compassion in terms of what we need from our healthcare system, that even if the government were to hit its own target, we would have the longest waiting lists in Europe. That's the level of ambition we're dealing with right now. The GP sector has been hit so badly that it is now impossible to get a GP in a growing number of towns around Ireland. Many hospital doctors, consultants and junior doctors are utterly demoralised, and they're now leaving the system or moving into private practice to such a large extent that it is becoming impossible to fill consultant roles that 10 or 15 consultants were queuing up to interview for 10 or 15 years ago. Nurses, many nurses are being asked to work in impossible situations. I've spoken to nurses who are dealing with levels of stress and levels of anxiety and levels of overwork and levels of overcrowding that are just completely unacceptable. And many of them are living in parts of the country, higher cost parts of the country, where they can't afford to get a mortgage. They can barely afford to make rent, or indeed pay for childcare. Some of the big costs that they're dealing with. So, why is this happening? Why is all of this happening? If we're spending almost more money than anyone else, we've got some of the best doctors and nurses in the world, and we're all agreed that we want to make it better, why are so many of these things happening? Why are children waiting the way they're waiting? Why are my constituents waiting for several years for orthopaedics, and so on and so forth? Partly, it's because the government has wrought organisational chaos on the HSE since coming into power in 2011. In 2011, Minister Riley came in and he said, I'm going to dismantle the HSE. Didn't tell them what he was going to replace it with, just that he was going to dismantle it. In 2012, he fired the board and marched them out in front of the RTE and other television cameras to parade in front of the world. In 2014, Minister Varadkar said he too would get rid of the entire HSE, and it'd all be gone by 2020. But he didn't say what it was going to transition into. In 2016, Minister Harris arrived, and he said, well, the HSE may not be abolished. In 2017, Sláinte Care said, we think the HSE needs its board back. The government said, okay. The Taoiseach now says that the HSE is not going anywhere, but it needs to be slimmed down. He said it's massive and it needs to be slimmed down, but he hasn't told the HSE what slimming is required. There is no management team on the face of the planet who could deliver a decent healthcare system given that level of organisational chaos. Couldn't be done. The failures in health can also be put down to political ideology, of course. Right now, I would contend that we have the most right-wing government Ireland has seen in decades, certainly in my lifetime. It has an obsession with tax cuts, and the leader of government proudly stated that he and they would represent those who get up early in the morning. He wasn't talking about everybody who gets up early in the morning. He was talking about professionals who get up early in the morning. That statement was a disgrace, and it is straight out of the Tory handbook. But why does this matter for healthcare? Who cares if we have a Tory government in place right now? It matters because right-wing governments are interested in smaller government, smaller public sector, bigger private healthcare. That's what they're about. It means not really buying into a great public health system. And it means believing your voters probably aren't too bothered about that because they have private health insurance. Now, I am biased. You don't have to believe me. I am definitely biased. I am an opposition healthcare spokesperson. There was a recent Irish Times podcast, you should listen to it, talking about the implementing Sláinte Care and why it wasn't happening. Pat Leahy said the following, quote, "I think that at the heart of some of the reluctance in government, and within Fine Gael especially, towards the plan, Sláinte Care, is the contraction it sees to impose on private healthcare." Now, the healthcare expert, the academic Dr. Sarah Burke, was on the same programme, and she said, quote, "I'm not sure he, the Taoiseach, fully believes in delivering universal healthcare for the people of Ireland." So that's from neutral people. That's from journalists, and it's from academics. Now, this combination of ideology and organisational incompetence has led, in part, to today's healthcare problems. As Susan Mitchell pointed out, 2011, 9,000 people waiting over 6 months. Now, nearly 40,000 people waiting over 6 months. In fact, in her article, the subheading started with the following question: is it possible to name one significant health initiative that was the brainchild of this government? Because the cancer care centralisation, the cardiovascular work, the stroke work, that happened in the early noughties under Fianna Fáil-led governments. None of it was initiated or dreamt of by the current government. Is there anyone who can make our healthcare system fit for purpose? The answer, of course, is yes. They do it in other countries all the time. Previous Fianna Fáil governments have done it, and indeed previous Fine Gael governments have done it too. Can the current government make our healthcare system fit for purpose? The overwhelming evidence would say no, it can't. For a future government to make our healthcare system fit for purpose, it's going to have to change the current approach. It's going to have to be committed, fully committed, to the principle of a great public system. It's going to need to make a stable tax base available to fund all of this. It's going to have to work very hard to earn the trust of clinicians, trust that has been lost, and in turn, trust clinicians to deliver the changes and the care that they know how to deliver. It's going to have to go hospital by hospital to make sure they have the right levels of management. That doesn't always mean less, as Colin has pointed out. Sometimes it does. Sometimes it means more. They need to have the right level of management, because I know from other clinicians that in other hospitals there are serious problems in trying to get things done. And critically, a government serious about solving this problem is going to have to make sure that the managers have the training that they need. We have incredible training for clinicians. But by and large, the men and women running the hospitals and running the different parts of the healthcare system, they're not as well trained as the clinicians. They don't have ongoing continuous professional development. In some cases, they have been senior clinicians themselves who may have been superb clinicians, but they don't know the first thing about running a €100 million budget, and they don't get the training. A future government is going to have to make sure that the hospitals and the clinicians and the managers have the freedom, the resources, and the knowledge to make local changes themselves. We cannot have a Stalinist system where from the centre, be it the HSE or the Department of Health or the Cabinet or the Dáil, where those people micromanage what changes are needed in hospitals. The people who know what changes are needed in hospitals, they work in the hospitals. A future government is going to have to replicate successes seen in cancer, seen in cardiovascular disease, seen in stroke. It's going to have to be honest with the public about the need to centralise specialities, while ensuring that smaller hospitals take on more elective work. Now, on a quick anecdote, Susan Mitchell talked about the centralisation of cardiac care and the political pressure that came to bear. I spoke to a Fianna Fáil colleague about this 2 weeks ago, and he told me that when the legislation came in and when the vote came in to centralise cancer treatment, Fine Gael packed the Oireachtas with protesters. Those of you who are familiar with the Dáil Chamber will know about the Visitors Gallery. They packed it with protesters from key swing constituencies. My colleague told me that on his way to the chamber for the debate and the vote, he was nearly physically assaulted 3 times. And they were all told by thousands of people in their constituencies, we are going to make sure that you are never, ever re-elected. So a future government and its TDs and senators and councillors and members are going to have to be very, very brave, because that kind of political heat requires a lot of guts to stand up to. A future government is going to have to set new waiting times and meet them. Waiting times that make us one of the best and not one of the worst. And critically, a new government is going to have to improve working conditions for our clinicians, for our doctors, for our nurses, and for our others. They are utterly frustrated. They are utterly demoralised. Now, I spent time in healthcare reform in the NHS, and when you talk to NHS doctors and nurses, they are proud of the NHS. They love working in the NHS. Not all of them, but a lot of them. And they're so proud of it. They know there's loads of problems, but they buy into the concept. I was delighted to hear Colin's impassioned defence of our healthcare system, but it's rare, which was kind of his point. You don't hear doctors and nurses say, I am proud to be a HSE doctor or nurse. They are deeply frustrated, and we're going to have to do something about that. So, what tangible changes are needed on the ground? Because so far it's all kind of high-level political stuff. Community healthcare needs to take on more work in chronic disease management and elderly care. That includes reversing FEMPI for GPs as a matter of urgency, introducing a new contract for GP-led community care, ensuring GPs have access to diagnostics, joining up the budgets for acute and social care, ensuring there are sufficient step-down facilities and home care supports, getting pharmacies involved in doing as much value-added work as possible. Emergency departments, they need modern triage and assessment. They need sufficient numbers of consultants and nurses. I was talking to an ED consultant in a big Dublin hospital. There are 4 ED consultants in the emergency department. They told me that the equivalent hospitals in Australia and England, dealing with the same populations, compared to our 4 consultants, have 16 consultants. Not 5 or 6 more, 16 consultants. Hospitals, we need to identify the blockages and remove them. Several of them have blockages in ICU. They don't have enough ICU beds. They don't have enough resus beds. They need to get the right consultant and nursing levels. And they do need more beds. Or at least some of them do need more beds. There's no question about it. Complex care needs to be pulled into bigger hospitals. More routine care needs to be pushed out to smaller hospitals. The consultants have to work across both. Patients need to be discharged to an appropriate care setting so they don't turn up in the emergency department 2 weeks later. Appropriate mental health services need to be put in place and funding provided, which hasn't happened yet. Patient records need to be electronic. You're nodding at me meaningfully. Patient records need to be electronic. Data needs to be collected on cost-generating activities like diagnostics and drug prescribing. The National Treatment Purchase Fund needs to be used as a short-term measure to deal with the waiting lists. Funding needs to be multi-annual, etc., etc., etc. We know what needs to be done. We know what needs to be done. We've got to have the political will to do it. The status quo is not an option. Our growing and ageing population means that if we don't modernise our healthcare system, the problems we're seeing today are going to get much worse, and they're going to get much worse really quickly. So the status quo and tinkering at the edges is not an option. So, on a nakedly political conclusion, if you will excuse me, as I am a politician, is there anyone who can make Ireland's healthcare system fit for purpose? Yes. I've been on Fianna Fáil's front bench for 18 months, and I'm now Fianna Fáil's healthcare spokesperson. And I can tell you that, in my opinion, the best option politically we have is a government led by Micheál Martin. It would be a government not obsessed with tax cuts, but with investment. It would be a government fully committed to the public healthcare system and to providing the people of Ireland with the care in the public system that they need and they deserve. Thank you.